I will start immediately with the title that is not that fitting anymore, but hopefully, anyways, there will be some comments that relate to the title. First of all, I think the biggest misnomer in this title is the social science part. And that's because it's the social science on and within and mosquito control is actually a huge field. And there's a lot of methodological approaches and different research foci there, including a lot of super valuable work on treatment-seeking behaviors and very sort of close to medicine and implementation work. And I will only talk about like a tiny slice of that and very specific slice, namely anthropological approaches and especially sort of approaches coming from medical and multi-species anthropology and mosquito control. And that's a field that has been growing over the last sort of 10, 15 years, and there's quite a bit of exciting work. And I want to share some of that work of colleagues in the beginning to set the scene sort of, and to give you a bit of an impression, and then zoom in a little bit with two case studies from earlier work that I have done on mosquito control in Ghana, and we'll close a bit with introducing a newer project that we're just starting at the moment, where I can't really share proper results yet because the project has just started in spring. But yeah, all in all, I will hopefully be able to shed a little bit of light on what it can look like to do anthropological studies on mosquito control. And what do I mean by anthropological studies? Super briefly, so I mean qualitative research, mainly employing ethnographic methods, meaning qualitative interviews, participant observation, accompanying people, observing their practices, taking part in the practices, having informal and also more formalized interview conversations. And also increasingly what is becoming sort of an important source material for a lot of anthropological work is also putting sort of this more observant interview data into the context of and in relation to health policies, political economies, global inequalities, and a variety of data sources there, so archives, but also statistics, scientific, other scientific disciplinary work. And an important methodology that has gained prominence within anthropology in that context is multi-sited ethnography that works on global connections. So studies that are not just based on one location or cultures, but rather sort of follows issues and topics. And I think this is an important approach also within global health. So where, you know, also interviews with UN organizations and so on are part of the field work. Okay, so maybe that, oh no, one other point, and this is also what I'm doing increasingly, and I will get to this at the very end most explicitly, is that interdisciplinary work with natural scientists, but also coming from, say, ecology, but also, of course, medical, biomedical sciences, are becoming much more important, and contributions to One Health and also planetary health approaches, I think, are an exciting new space where anthropology is also one of the active disciplines. And as I said, in the end, I will come back to that a little bit more to hopefully give you a feel what that can look like. Okay, but without further ado, I will jump into, if it lets me switch slides, it does, into what I promised in the beginning, namely a little taste of the sort of recent exciting work done by colleagues on coming from anthropology, human geography, and allied disciplines on mosquito control. And I think I want to start with Tulio da Silva Maia. Can you see my cursor? Yes, the piece is here, or my screenshot of the piece, and his name is not on, I just realized, but a Brazilian colleague working at the University of Exeter at the moment, who's working on what he names other than vector ecologies and geographies of mosquitoes, where he's really looking at the sort of social ecologies and the entangled histories between humans and mosquitoes and their environments and the changes of the environment. So rather than looking just at interventions to control a certain disease, in the case of this article Zika, he's really trying to understand how also changes in cities and lived realities of how cities are lived, and how that relates to breeding space, places, and sort of likelihoods of disease occurring are intermingled. And so he says, rather than sort of easy war or combat framings of disease that often also have sort of side effects or unknown repercussions, he's also interested in sort of plural ecological roles and how getting sick are a reminder of the fact that an exaggerated focus on combating them builds up social and political effects and erases others. So just as a small sort of dip into it, and I'm just realizing I probably can't talk about all of these because then the half an hour is over. So let me just pick out one other early career colleague, namely Luisa Reis Castro, who's based at the University of Santa Cruz, I think, in the US, and her article here on the bottom right, Becoming Without, Making Transgenic Mosquitoes and Disease Control in Brazil, is concerned with the more and more employed vector control technique of transgenically sterilized mosquitoes. And she has studied a biofactory in northeast of Brazil that is dedicated to mass producing these transgenic mosquitoes. And she's been looking at the different forms of labor employed and how sort of societal relations are reconfigured while the disease vectors are configured. And she's asking what sort of happens when so-called frenemies are created, namely mosquitoes that don't transmit disease anymore and so sort of contribute to keeping humans healthy, but at the same time then it's still the mosquito that is also possibly the agent that transmits disease, right? So I will leave it there, I think, but just to mention the other colleagues' work that is here on the slides are all concerned with sort of societal implications and the rather complex stories of how sort of societal conditions of how to live and where to live, economies and labor, poverty, and so on are entangled with disease control interventions, which is particularly evident in mosquito control. That is always sort of a control of living environments of mosquitoes, but also of humans, right? Okay, but so to make this a little bit hopefully focused and clearer, I brought you two small cases from my previous work in Ghana, as I already said, and two small sort of contributions of what anthropological work and bringing in sort of all sorts of strange factors might contribute to an understanding also of global health, and ultimately also to productive and sustainable disease control or mosquito control. And the first one is the case of insecticide-treated mosquito nets, and the question of sort of context, and in particular economic context. And so since the Millennium Development Goals, international organizations have given malaria control renewed priority, and in particular since the mid-2000s, insecticide-treated net distribution has become an important tool to achieve that. And the distribution of mosquito nets on now mainly the African continent, and in particular Ghana, which I'm going to talk about. The dominant procurement agency is UNICEF. So basically sort of the #1 customer for insecticide-treated nets. And nets are mainly financed through country grants from the Global Fund or other international donor agencies. But what is also important is that not every mosquito net brand can be purchased by these donor agencies, but rather the WHO via the pesticide evaluation scheme certifies net producers that adhere to safety and quality standards, and that has certain effects. I won't comment on that now, but this is we could talk about it in the discussion if there's interest. And in Ghana, the distribution, or quite a bit of the distribution, happens with the Ghana Health Service in a collaboration between the Ghana Health Service and UNICEF and some other agencies and NGOs. And they run a free distribution of nets to vulnerable groups at the National Integrated Maternal and Child Healthcare campaigns, for instance. And you can see a picture from one of these campaigns for coupon to collect a free insecticide-treated net here on the picture. And on the left is a small field excerpt of mine. And I will just read that out now. I meet my friend Samuel. As usual, we start to talk about malaria. After some time, he tells me a family story. He says his mother used to make bed nets in Tamale and sell them there. Turns out that not only his mom was doing it, but also many other people in Tamale. This was a local business and well established. It had its own local economy. Samuel characterized the economy to me as follows. The materials would arrive from Europe together with used clothes. Netting material arrives in big balls. Some of them were bigger net structure, which was used for clothes and curtains. The ones with finer netting were used for mosquito nets. The material would go to a tailor who sews nets out of the raw material. The sales were good, albeit seasonal, especially high in the rainy and harvesting seasons when mosquitoes are abundant and people also have money to buy the nets. So these nets that he's talking about are, of course, not the same nets than the nets that are distributed, right? So because the second nets carry the insecticides, but still they sort of have the same market, right? And this is then one of these unintended side effects of this really important and valuable global health intervention of distributing insecticide-treated nets, namely that the penetration of these international nets into the Ghanaian market has meant that this tiny niche bed net producers have lost their income. And so without wanting to question the health intervention, still it shows that there is a certain erasing of local practices and networks in the names of development and global health happening there. And this is, of course, by no means a new phenomenon, but has long been deconstructed in critiques of development initiatives. But nevertheless, they still ring true for the case of these insecticide-treated nets. And it does prompt the question how one would be able to think more carefully in also putting these programs together, in working with, not parallel to, existing local economic structures in the production, the distribution, and also the marketization of these bed nets, right? So the question of context here is one where I would like to draw attention to sort of one of these societal embeddings of health interventions. And yeah, so this is sort of the first case, and we can discuss it later if you like. The second case also comes from Ghana, and is another hugely influential and successful malaria control and mosquito control intervention, namely insecticide indoor residual spraying, that you can see here on the left on the picture. And indoor residual spraying has one of the so there's a few agencies that have started with indoor residual spraying in Ghana also in the mid-2000s, but one of them is also the US Presidential Malaria Initiative, was one of the sort of pioneers. But the second pioneer that I want to talk about today was a gold mining company in sort of central Ghana that has implemented this project as part of their corporate social responsibility activities. The program started to run in 2005 and has reduced malaria incidences by over 75% in the city where it started to run. So again, it's a very influential and important, successful healthcare project. But there's also, and the project, so that corporate social responsibility project still runs today, but in a extended form as well. It's namely been the model project for a global fund project that started in 2010 in Ghana, mainly in districts in the north of Ghana, and is running until today. And the company is in fact the principal recipient of the Global Fund money, and it has made that company the first private recipient of, I just looked it up again today, of 116 million US dollars over the last 10 years, 11, 12 years. How does it work? And sort of what is my point here? So the spraying works in 2 cycles per year. And besides the implementation of spraying and also entomological research that is happening alongside the project, mainly sort of this initial project had a third component, but also the projects now, namely community liaison. So 5 members of staff in this medium-sized city in Ghana go after the spraymen, as the team leader Rashid has put it when I accompanied them. If the sprayers don't find people in a house, or if people refuse to get their house sprayed, Rashid's men go and check. Often Rashid says it's enough to educate people on where malaria comes from and inform them about the symptoms. Mostly people don't think it's caused by mosquitoes if someone dies early. It's believed to be witchcraft or other things. When people learn, they often let the men spray. Rashid organizes local committees in the municipality and meetings with the workers' union. The project bought airtime at the local radio station twice a week in order to discuss the project and answer questions. So Rashid and his team are doing a great job at the community relation, and the community relation seems to be working well with approximately 95% coverage rate. But what also helps are sort of the subtleties of the public advertisement that you can see here on the right-hand side on the slide. So one sentence on this poster is to be noted. It's unfortunately a not very good picture, but you can see it here. Every house in the city must be sprayed legally. This is not the case. Not every house must be sprayed. The company can and does require residents of company houses to allow the spraying, but has no power over private housing in the municipality. But the sentence does play with the fact that A, people might not know this, and B, that they might not feel able to resist the power of the company, who is the main provider of formal employment in the city, as well as the region. So this poster could be read as a subtle coercion mechanism. However, the public engagement process of the project cannot justifiably be reduced to this sentence, as the teams are in constant dialogue with the community. But, and this is the crucial point, the relations with the community focus on education about malaria and on convincing people that the project is needed. The underlying assumption is that people do not understand the correct scientific cause of malaria, neither do they know how to prevent it. And so the project focuses on education by drawing on behavior change communication tools. But while considerable effort is made to bring the public on board and inform them about why the project is useful, the overall strategy of the project and the intervention was designed without involvement of the public. And one of my interviews from a local mining watchdog NGO remarked that the so-called beneficiaries, the citizens, right, had never had a say in how questions and the overall design of the project. And while one can report adverse reactions, dislike of the smell of a particular insecticide, or also refuse to take part in the spraying, the NGO worker stated that no public inquiry on the potential content and nature of the project had been conducted before the intervention started. To him, the company's choice to concentrate their corporate social responsibility activities on malaria ignores long-standing demands of the community to cover abandoned mining pits as part of the company's responsibility. And so what is the point here? I want to make the point is that I think it's important to look at how public health projects, and in particular private-public partnerships of various sorts, are embedded in societal concerns and how decision-making is done at various stages. So in short, I would like to argue that education might be an important component, but it's not enough. We should rather aim to experiment with communities and citizens and not as sort of impose the projects on them. That's too strong a formulation. But anyways, I want to close the section here also because the time is sort of running out, but I just want to end that the legacy of this corporate social responsibility project is of course huge, right? As I said in the beginning, it's now a major global fund project that is administered, and in 2021, 10.1 million structures in Ghana, meaning houses, were covered by the indoor residual spraying. And I already mentioned the over 116 million US dollar investments the Global Fund made. So out of this small corporate social responsibility project, a big project happened. And I think it's important to inquire into sort of the origins and the setups and think about these wider societal contexts. And this is what I think where the contribution, or one of the contributions of anthropological research lies. Okay, so I hope you enjoyed these two short anecdotes, and it made a little bit clearer what I said at the beginning. And I just wanted to end and say a few sentences about a new interdisciplinary project that I already briefly mentioned at the beginning, that is funded by the Volkswagen Foundation in a program on global challenges in mobility and global health, mobility and health. And this project I'm involved in together with a team of entomologists and ecologists and anthropologists and human geographers from the University of Heidelberg, Carsten Vergin and Norbert Becker, and then myself. We are the sort of Germany team. and then a team in India around Dr. Ashwani Kumar and the Indian Medical Council and their vector control unit, the Ifakara Health Research Institute with Fredros Okumu and Najat Kahamba, and the UNAM University in Mexico with the veterinarian and ecologist Gerardo Susan. And in this project, we're trying to understand the mobilities of humans and Aedes mosquitoes, so the mosquitoes that can transmit or have the potential to transmit dengue, Zika, chikungunya, and a host of other diseases. And the Aedes mosquitoes are considered invasive mosquitoes in many places, including in Germany. And we are looking at how these mobilities of the mosquitoes, both within countries and between them, not between our country cases, but between sort of within regions, right, are entangled with human infrastructures such as the trains and also buses, and trucks that are carrying goods such as fruit and so on, and how these sort of human mobilities are entangled with the mobilities of Aedes X and also flying mosquitoes. And I think I will leave it there, but just say that, oh yeah, no, that's a bit of a misleading map. I need to explain that more, but I don't want to take more time. So I will just say one of the aims of the project is to do sort of a similar thing to what I outlined in these cases, namely to bring together the entomological data about mosquito distributions and densities, and with the more sort of social, societal data that focuses on lived experience, how people in particular places and moving between places are encountering mosquitoes, how they protect themselves, where they sort of see hotspots and so on, and trying to bring together sort of the strength of these very different disciplines and perspectives. So I think I will leave it there. Thank you very much for your attention, and I look forward to the discussion.